Okay, so how's it going? We did your left hip back in 2010, right?
Correct.
And we did that through the posterior approach. And how's that doing for you? Any pain?
No pain at all.
Good, good. And what are you doing now work-wise?
I am a mechanic. I work for Chrysler.
Right, okay. Now on the left side, we did the posterior approach. Do you remember, did you have much pain after that? Do you remember what your recovery was like?
Well, in the first week, yes, kind of painful. But after that, all the pain that I had in my lower back was gone.
Good, good, good. Now we did a metal on metal surfacing, or the two parts that articulate, instead of using plastic, which we thought since you're a young guy might wear down, we used metal liner and a metal ball, which is a little controversial now. There's some concerns about the metal debris and stuff. Have you noticed any problems with that?
Well, I had 3 episodes of that. It was making noise, squeaking noise.
Squeaking?
It's squeaking noise. Every step I would give with my left leg, it would do a squeaking. So the first and the second episode, it only did it for a couple of hours. The third one, it did it all day. It happened all day, all squeaking, and it only stopped on the next morning.
Now, was that painful at all for you?
No pain.
And you've not had any more episodes since that?
No.
Because squeaking is fairly common with the ceramic hips, but it's not been really reported much with the metal on metal. We did check some blood work on you, and that looked okay. A little elevation of some of the blood work, but nothing too concerning. The idea was that the metal on metal would last longer for you, given your young age. Now you hear about the recall hips. We did not use I did not put in any of those hips that got recalled, so you don't need to worry about that. So I don't think we'll ever have to do anything with the left hip. But now your right hip's starting to bother you.
A lot.
So I notice you're limping a fair amount. Is it affecting your ability to work and stuff?
Yes. It affects everything I want to do, even in sleeping. It hurts.
So it's keeping you awake at night?
Keep me awake at night, and every time I want to move my leg, sometimes I have to carry the leg.
Right, right.
I can't move it.
Now with your left hip, you went right back to work as a mechanic. Since we did the posterior approach, we tried to keep you from doing certain motions. Did that limit your ability at work? Did you find that you had to change kind of the way you did things?
Yeah, a little bit. Kind of scared to have it dislocated. You know, the way I bend down, the way I put my knees down, and it's different.
Right.
I'm getting used to it, but it's different than it was before.
Right, okay. So, do you feel like your legs are equal length?
Yes.
Okay. So you've got good motion of your left hip, which is your new hip, and
Ouch.
little restriction of motion, but a lot of pain. So here are your x-rays. This shows your left total hip replacement. This is a titanium stem that has a porous coating that bone grows into, a titanium cup that bone grows into as well. There's the metal ball, and you have a metal liner. Your other hip shows the evidence of avascular necrosis, where part of the bone has died and it's collapsed and is no longer a nice smooth surface, so that's why you're getting pain in this hip. So we hope to have basically the same prosthesis on this side, almost, it should look identical. It's just that we'll be going in through the front instead of through the posterior approach as we did on this side. But the x-ray and the outcome should all be about the same. I've been doing the anterior approach now for 2 years. With the posterior approach, your incision is back here, where we have to split the large muscle back here, and we have to cut all the muscles in the back, pop the hip out when we put the new hip in. That's why we restrict you from flexing up and turning in for fear that it would pop out the back. With the anterior approach, we make our incision about right here. We go between these two muscles, and goes straight down, and the hip is right there. So we don't have to cut any muscles. So recovery should be much quicker. Pain after surgery should be much less. It's a much smaller incision. And I think one of the big things is that you don't have to worry about popping it out of sockets nearly as much. Now, any hip replacement you can pop out, but going through the anterior approach, we don't give you those precautions as far as flexing and internally rotating, because everything is still intact in the back. So it's pretty tough to get a hip out to come out the front. Although not impossible, the risk is much reduced, so we don't put you on any of those precautions. So it may be a little odd and hard for you to remember you still got precautions on the left, no precautions on the right. So that's our plan. Still all the same risks and complications that we talked about before. Any questions that you have about going forward with the right hip going through the anterior approach?
And when am I expecting to go home after surgery? What it will be like?
Well, we plan on getting you up walking that afternoon after the surgery. Physical therapy will come and get you up walking. You can put full weight on the hip. The next morning we'll get you up with physical therapy, and again the following afternoon. And I would say that you'll probably be able to go home the day after surgery. That afternoon after physical therapy, we'll then arrange for physical therapy to come to your house. We'll have a visiting nurse to come to your house. So when you go home, you ought to be able to get out of bed on your own, get to the bathroom, get to do everything that you need to do on your own, so you won't need a lot of help. I would say most people are on crutches or a walker for maybe a week, if that, and then maybe a cane for another week or two, and walking without anything by probably 2 or 3 weeks.
That's great. No, I'm excited.
Good.
I'm looking for less pain.
Good.
Less recovery time.
Okay.
I'm getting back to work soon.
Right. All right. Well, great.
Total hip replacement.
Total hip replacement. And who did that surgery for
Dr.
you?
Dalton.
Okay. And how long ago did you have that surgery done? This morning?
This morning.
Okay.
7. I check in at 5:30.
Okay. So you had surgery this morning. So right now we're about 6 hours after your hip replacement surgery done. So tell me how you feel right now.
I feel good.
You feel good?
Very good.
Pain-wise?
No,
you have any-
no pain.
No pain whatsoever? Okay.
No dizziness, nothing. I mean, I feel great.
Okay.
It's unbelievable.
Okay. Any nausea,
No nauseous,
anything?
no.
Okay. So tell me, how did you feel before you came in? What kind of pain were you having? Were you having any limitations? And then
Yes, I had limitations to walk, to sit, to sleep,
Mhm.
pain. Pain would go like 24 hours.
Okay.
It wouldn't stop.
So right now,
Right
6
now,
hours
6
out
hours
out
out.
from surgery.
I don't have anything.
You don't have any pain whatsoever. Awesome. Now I understand that you've had your other hip replaced. When was that?
I was June 2010.
Okay. And did you have the same anterior approach?
No, I had the posterior.
You had the posterior approach. So tell me a little bit about your recovery with that procedure and maybe how it compares.
Well, on the posterior approach, 6 hours after the surgery, I would be sitting on the chair like that. I would be in bed, sleeping, nauseous, pain, and I feel 100% better. It's amazing.
So totally different.
Totally different.
Right now, you are way farther ahead of where you would have been maybe a day or two after surgery.
Yes, I am. Feeling like this, I would be at home maybe on the second, going to the third.
Okay. All right. Awesome. So given your experience, would you recommend anterior hip replacement by Dr. Dalton to other patients?
I would, 100%. 'Cause it's amazing. You go to the surgery room 6 hours later, you can sit, you can get up, no pain. And I'm sure if I can walk without without help.
Really? So your hip feels strong
Feels
enough
strong
that you
enough
could
that I could
actually walk on it. Awesome. So that's just kind of helping to
That's
stabilize a little bit, but you
yes.
feel strong.
Right.
Outstanding.